What about bypass surgery?
Well, the gastric bypass has its own set of complications. Dumping syndrome can occur after a patient eats anything sweet. They feel extremely weak, they perspire, they feel nauseated, and they have to just lie down. Gastric bypass can cause ulcers in the remaining portion of the stomach. It causes long-term iron, vitamin, and mineral deficiencies so that the patients have to take supplements for the rest of their life.
So tell me, how is the gastric sleeve better?
The gastric sleeve has fewer complications, both short and long term. There are no disconnections of intestine and rerouting of the small bowel. Patients don't get dumping syndrome. They don't get marginal ulcerations. They don't have deficiencies of iron, vitamins, and minerals. They don't get hernias because there's no rerouting of the intestine. There's no foreign body, so it can't slip or erode into other organs. And it's just an overnight stay. And one of the major advantages of the gastric sleeve is that the portion of the stomach removed produces 90% of the ghrelin, that's G-H-R-E-L-I-N,
what is that?
That's produced in the body.
Okay.
Ghrelin is the most potent hormone in humans to cause hunger.
Wow, that would be a great thing not to be hungry. How does someone actually get started?
We have a seminar at the Laughlin Educational Building behind Santa Rosa Medical Center. It's the last Tuesday of every month at 6 p.m. And I have a website with more information for patients.
How quickly does someone see results?
Patients will see results immediately, and they will continue to lose weight for the next 18 to 24 months. After they achieve their goals, they'll be able to keep the weight off because we educate them on exercise, which can be as simple as walking, and food choices.
Well, doctor, this sounds like a very comprehensive approach.
It is. This is not a surgeon who operates on patients and turns them loose. We have a multidisciplinary program. Every person will see a pulmonologist, a lung specialist, a cardiologist, a heart specialist, a nutritionist, a physical therapist, and a psychiatrist. And this is to make sure that patients are in the best possible shape before the surgery, that they have these people if they need them after surgery, and that's how we get the best results.
Well, Doc, we've had a chance to talk to some of your patients. Let's take a look and see what they have to say.
Well, I have to take it like one day at a time, really easy, you know, getting in and out of bed, you know, so I wouldn't fall, because I've fallen a lot of times in different kind of chairs. I mean, wheelchairs I was in, you know, so. Of course, I was a lot heavier then, you know, but I'm just a little bit lighter now. I even got 2 rings on one finger now.
Oh, it tickles me to death to see her get out and be able to get in the pool and go swimming, or she could swim before, but I had to have help getting her in and out of the pool.
Do it if you'd like to live better than you've been living. It'll give you a lot more freedom, like I said, to move for myself. And you can get on with your life and not have the big problems that overweight brings.
I would tell anybody, don't wait before it's too late. Some people, their health, literally losing the weight depends on it. And I would encourage anybody, again, as long as they find the right physician, to pursue it.
After a patient loses weight, they're 60% less likely to die from heart disease, 60% less likely to die from cancer, and 92% less likely to die from diabetes.
Well, I watch TV all the time, and to me it would get really confusing where to go to, what to do, what to buy, because there's so much stuff on TV. What's your take on that?
America spends more than $30 billion every year taking care of the comorbidities, the diabetes, hypertension, and all those other diseases. They spend more than that every year on lose weight quick schemes and scams. If those things worked, they wouldn't be on TV every time you turn it on.
So they have the desire to lose weight, but they're just not actually looking at it from a disease point of view, or they think they don't need surgery?
Every patient who's obese wants and desires to lose weight, but they can't. This is a genetically related disease. These people don't want to feel that way. They don't want to be obese, but they can't lose weight.
Does it cause depression? Because you
significant depression.
So I would think that, you know, when people are listening to what we're talking about, that they at least look at it as another option that might be better and that will work.
Many of my patients' depression is gone, as are the other comorbidities we talked about.
It actually did affect my business, and part of it is, I think, appearance. I look better, of course. I feel better, so that just comes out in my self-esteem and my personality. And it actually did help increase my business considerably. And I'm in sales, and so I'm dealing with the public all the time. And it has helped tremendously.
As far as pain, I don't have any pain anymore. My feet are not swollen anymore. I feel much better. I don't feel anything different. I just can't eat less food, but I mean, I feel the same as before as far as energy, but like I say, back pain is gone, knee pains are gone, swelling is gone, and mentally I feel 100% much better, much better.
Taking the weight off, I think I've probably given myself a lot longer life, a lot healthier life. I get to enjoy my children. I now have 2, but I get to enjoy my son and all of the stuff and activities that he enjoys a lot more now than I ever did in the past.
Did you know that obesity is a recognized medical disease? Are you tired of being discriminated against because of your weight? Are you having medical problems that you need to resolve? Do you want to get back to your old self, confident, happy, and healthy? Today you can make this a reality, and it's cheaper than Jenny Craig or Nutrisystems, and it's permanent. Call the Weight Loss Surgery Center of Northwest Florida at 850-995-0875 to get started. Enjoy a personal, private, free evaluation to see if this procedure is right for you. Learn about your options and explore how you can significantly improve your health and enjoy life. The evaluation is free. Call 995-0875. When do you want to start?
Well, Doc, do you have any final thoughts?
Patients who struggle with obesity and the major illnesses and diseases that it causes know how they feel.
If you or a loved one needs this surgery, check out the details with Dr. Althar. Now you can live a healthier, happier life. Thanks for joining us. We'll see you next time.
Call now and talk to Melissa, our receptionist. She's actually been through this procedure and will be glad to share her experience. This is cheaper than Jenny Craig, and it's for life. Call 995-0875 or check out more at www.dralthar.com.